with you through every step of your remodel. Call us or visit revamp.com.
Good evening. You're listening to the Garden City Community Chat Show with your hosts Carrie, Tom, and Mike. Sit back, relax, and enjoy the show.
Well, hello, Garden City and all our surrounding neighbors. Let's give a shout out to Westland, Canton, Dearborn Heights, Dearborn, Livonia, and Inkster, just to name a few. Welcome to episode number 693 of the Garden City Community Chat Show. It is Thursday, January 30th, 2025. Excuse me. We're so happy you could be with us tonight. We hope you're all safe and doing well. I am your host, Carrie, and also joining me tonight, former Garden City Councilman Mike Jones. How you doing, Mike?
I'm doing great, Carrie.
Good, good. Also, Garden City's very own and busy meteorologist, Dr. Tom Iwinski. Tom, how's it going?
Good. A little warmer than the last couple of days, but definitely turning the corner maybe in winter, but we'll see.
We'll take it for sure. Tom's going to be back shortly with the most current and up-to-date forecast for you. And then Mike's going to close out the show with some community events happening, so have your calendars ready. Also, it's a new year, so that means tax time is here. So tonight we have our second installment of Joe Bartley's Tax Talk from J&J Taxes and More. So we hope you'll stick around for that a little later. On tonight's show, we are focusing on men and women's health. And we are happy to have Dr. John Frederick Harb from, he is the Harb Urology. And he also just happens to be my urologist. So statistics have found that it's very difficult for some to talk about from the waist down and the knees up. So tonight we're going to be doing that. I'm also going to call this Too Many Pit Stops. I borrowed that from Dr. Harb's brochures. So be sure to listen. We're going to be discussing a lot of good information tonight. I want to put a disclaimer out there right now. Some of the topics that we may talk about you might feel uncomfortable with, but keep in mind these health issues need to be discussed. So please stay tuned. And just a quick show update. Mark your calendars for February 13th when we welcome our city manager, Tim Gibbons, to the show. He'll be here. And on February 20th, the boys from DSD Sports Chat, they're going to be back, and we'll be talking lots football for sure. I also want to mention real quick, if you're watching us live on Facebook and YouTube, go ahead and post your questions and comments in the comments section. You can find us live right now on Facebook at facebook.com/GCChat. And over on YouTube, just search for the Garden City Community Chat Show. You can also email your questions to us at gccommunitychat@gmail.com, and we'll do our best to get those answered for you. Remember, we're here to promote not only our community, but yours as well. And speaking of community, if your community organization or business has any events, announcements, or cancellations that you'd like to get out to our listeners, what do you think they should do, Mike?
I would suggest they email us.
Suggest is right. Email the details to us at gccommunitychat@gmail.com or message us on our Facebook page, and Mike would be more than happy to pass that information along. Remember, you're always welcome to come on the show and promote your community, business, or organization anytime. We also encourage any local business to check out and join the Garden City Business Alliance. See what great things they can do for you. For more information, head on over to gardencitybusinessalliance.org. Okay, we're going to get Tom in here with a check of the weather, and then we're going to be chatting with our guest, Dr. Harb from Harb Urology. So stand by. Okay, let's do a check on weather with Doppler Tom. Let's see what he has in store for the rest of this week and the weekend coming up. Tom, take it away. Hey, it's kind of nice out there today. Can't complain.
Yeah, we got well into the 40s today. We're hanging around 40 right now, and we're going to see some rain instead of snow in the future. So we'll take it, right? So overall, again, like I was saying, we're around 40 degrees at this hour, which is incredibly nice for this time of year at this time of day as well. It could be much worse, as we know, but overall, we are starting to see those clouds beginning to thick up all day today, and we are going to continue to see overall cloudy conditions continuing through the rest of the evening before we start to even see some rain beginning to pick up during the overnight hours after midnight and into Friday morning. Overall, this will be mainly a rain event as we see fit. Temperatures are going to be cold, but not cold enough for snow. They're going to be in the upper 30s, which is just cold, just warm enough for this to be an all rain event. And overall, as we get into the day on Friday, obviously we're going to be seeing the rain throughout the morning and into the afternoon. Again, those temperatures will be fairly stagnant in the mid to upper 30s all day tomorrow. So overall, the rain will continue. But as the system wraps up, we could see some wet snow on the backside of it. No accumulations will come out of it, but a few snowflakes could come out of it as we get after sunset tomorrow, but not expecting much in the way of anything too exciting coming out of it as we start to get a little bit colder as the system begins to usher in a little bit warm or a little bit more colder air on the backside of it. But overall, nothing too exciting as we get into the lower 20s for Saturday morning. And overall, we will be seeing those temperatures in the lower 20s as we get into Saturday morning, drying out on Saturday, so not too shabby. We will struggle to warm up though during the day. We're probably going to hang out below freezing in the upper 20s for high temperatures on Saturday. So just a typical winter day as our clouds will gradually be fading in and out with a little bit of filtered sun throughout the day on Saturday, and then starting to get a little bit warmer as we go into Sunday. We will be seeing those temperatures rising into the upper 30s to lower 40s. And again, we could have another weak system moving through on Sunday, which could have some lighter rain early in the day. But for the most part, nothing too exciting. I'm not expecting any wintry weather with this system. Our temperatures will probably be just warm enough for that at this point. But overall, nothing really too exciting. We're just going to be seeing some pretty good rain tonight into the day tomorrow. And as we go into next week, temperatures don't get really warm or cold. We remain fairly stagnant in that regard. We're going to be seeing temperatures on Monday remaining in the upper 30s for high temperatures. And overall, no big systems to really track at this point. As we go into Tuesday, we will be keeping an eye on our next system. For the most part, all of the day on Tuesday looks dry at this point. Temperatures will again be hanging around the freezing mark in the lower 30s. So overall temperatures won't be completely dropping the ball next week, but not too cold by any means. And as we get into midweek, we could see a little bit of light snow as we go into Tuesday night and into Wednesday morning. Some snow flurries moving through with that colder air during the early portion of the day, and then changing over to rain as we get into the day on Wednesday. And overall, we could see some heavier rain mixed in here as we get into Wednesday night. Overall, that will be something we're going to be keeping an eye on, but temperatures will be just above freezing. So this looks like it will be an all rain event, but we could have rounds of some heavy rain mixing into this as well. And then wrapping that up as we get into the early portion of Thursday morning. So the next round of rain, the more substantial one, will probably be Wednesday night into Thursday, outside of tonight into Friday morning. Again, more rain than snow and anything. We really will take it. I mean, we can't complain too much. And then we could see some on and off rain continuing throughout the early Thursday before wrapping up as we get into the nighttime hours. So nothing too shabby on the horizon. We'll take it as we wrap up next week on the 7th. We could again see a little bit of snow during the overnight hours, again during that coldest portion of the period of the day, in the night. So some light snow flurries are possible, but nothing major, no major winter storms with no substantial accumulating snow by any means. I don't see that in the forecast. We have really dodged the bullet this winter in that regard. We haven't seen a major winter storm by any means, and I don't think anyone's complaining. It's kind of a scary thought because sometimes it makes it up as we get late in the season. It likes to do that. So I'm not saying that is going to happen, but the big one will eventually probably happen. I just don't know when it will be. It's just definitely not in the foreseeable future. So we'll see when that exactly will happen. But other than that, we're just going to keep an eye on some rainy systems moving through with a little bit of snow on the backside of the cooler portions of the day, which is nothing we can't handle here in Michigan. But overall, if we expand outward and quickly talking about some other weather across the country, we'll see where that rain is at. That's going to be moving in tonight. It is starting to begin to move into portions of the region. You do see it developing across Indiana and into the Ohio River Valley as well. We're starting to see pretty good rain shield moving in as well as this continues to load up. There's some pretty good rain around Kansas City right now as well with this system. So this whole system as a whole will begin to move into our region again tonight, and we'll keep an eye on that. This system also is producing some pretty heavy rain as well with some flooding at times across the Tennessee River Valley. So we'll keep an eye on that. It is going to be moving into Washington, D.C. as well as we get into tonight and into the day tomorrow. So that will hamper the ongoing issues that happened, that tragic air collision. So that will be the only weather toward that region that we have to keep an eye on. But other than that, there's some pretty good thunderstorms again down into the south as well along this cold front. So quite a bit of weather actually to track tonight. And overall, the west is starting to quiet down as we finally start to get some rain moving into Southern California, which put a lid on those wildfires. So at least we'll take that. But other than that, the weather always is busy. And if you want to keep tuned to all this local weather information, just go to this website, DopplerTownsWeather.com, and it will keep you updated as we continue to roll on in winter as February begins very shortly. Already flying through the year, I feel like.
Yeah, really. But, we'll take it. That's for sure. All right,
yes.
sir. Thank you. I will see you next week, right?
Absolutely.
All right. Have a good night.
What about
Thank you,
Groundhog Day?
What's that, Mike?
What about Groundhog Day?
Yeah.
What about the commercial holiday? I don't know. It depends on how many cameras they got out there and the lights, and whether they'll see the shadow or not.
Yeah, I'm not going to rely on no groundhog. All right. We'll see you, bud.
Take it easy, man.
All right. Bye. All right. Let's give a shout out to a few people in there that are watching before we get to our guests. Michael Bingle's in there, and we have a few questions already for the doc. Michael Bingle's in there. Ed Wilhite from Hogg's Backyard Barbecue is in there. Mrs. Chad is in there. Annette McNeil is in there. Hi, Annette. How are you? Good to see you. Good to see you. Also, we got about 5 or 6 others that I can't quite see who they are. So keep them coming, folks. If you have any questions, put them in the comment section, and we'll ask the doc about that, okay? All right. Let's introduce our guest for tonight. He is with Harb Urology. Please welcome Dr. John Frederick Harb to the show. How you doing, Doc?
I'm really, really well. Thanks for asking, Carrie. Thanks
Awesome.
for having me on. You're
Oh,
awesome.
anytime, anytime. So thank you so much for taking the time to come on. We really appreciate it. I just want to mention real quick, you are my urologist, and I'm an open book here on the show. So why don't you go ahead and just briefly tell everybody what you did for me and help me.
Well, Gary presented with some blood in the urine and difficulty urinating, and we found a little growth in the bladder that we removed. And we subsequently took care of a voiding problem where he was urinating quite a bit and
Mhm.
slow stream, and we kind of opened it up in more advanced techniques using plasma vaporization. And it was very successful. It's considered the gold standard.
Wow.
It's should last about 10 to 20 years,
Mm.
and it just changes and improves quality of life for men. It's kind of
Yeah.
exciting that the work we do really changes things for people almost the next day.
Yeah. And it's true, it is difficult for people to talk about. Like I said, I heard that from you, from the waist down and the knees up. It's just, I don't know what it is. It's just, especially men, they don't want to talk about it.
Yeah, it's when we talk about screening for prostate cancer, it happens to be the number 2 cancer in men over 50. So you got to talk about it sometimes, and you got to evaluate and get checked out for it. And there's quality of life is important. We're living longer,
Right. Right.
and we want to live. The golden years weren't meant to be all about knowing where the bathroom is and about urination. The
That's right.
golden years are, it's supposed to be quality of life. So let's make it better.
Yeah.
That's where erections even come into play, erectile dysfunction. I mean,
Right.
it's something, internists don't have time to even ask about it, but it's what we
Yep.
manage every day. And we can create a better life for people. And so it's kind of exciting to make changes in that way for these people.
Well, you've been,
But we also take care of women too. Everyone thinks of urology as a male for male doctors, like in gynecologists for females.
yeah.
But half my patients are female. We take care of incontinence, renal stones, kidney cancer, bladder cancer, urinary incontinence, urgency, frequency, just kind of all kinds of stuff that we can correct, and everything is correctable below
Yeah.
the belt. That's what's crazy. There's ways to fix everything.
Yeah. Exactly. And prostate, it's all treatable, right? I mean, it's fairly
It
treatable.
is, there's about 250,000 men diagnosed every year with
Hmm.
prostate cancer in America, and about 30,000 die of the disease. But those are the people that really are late stage, diagnosed later, and just advanced with family history, let's say. But there's so many cases where we diagnose cancer and we just watch it. The low Gleason score cancers, it's okay to watch it. Watchful waiting and active surveillance is totally reasonable approach. In the old days, we used to, remove prostates all the time with a robotic
Hmm.
technique, but now we're looking at it a whole different pattern. The bladder cancers that pop up, the superficial are fairly common. The more invasive ones that are in the muscle aren't as common, thank God, because those kind of advance quickly.
Yeah.
50%, you know, succumb with advanced cancer in 5 years, and that's not so good. But with
No.
superficial, we can manage it. We can, it's like plucking weeds from your garden or from your front lawn.
Mhm.
You see it, you remove it, and you
Right.
prevent from sending weeds down. So the follow up and the continuity of care is important, and the compliance of patients. And if we just work together in the community, we can pull it off.
Mm.
I actually took over the Garden City Hospital as the only urologist there. Um,
Right.
and that hospital used to be a mecca for urology, believe it or not. There was 4 or 5 urologists there, and I can mention some old names
Oh,
of
wow.
doctors that used to train. There's a big training program there.
Mm.
And so we're trying to bring it back to its glory days because there's definitely a need for it. There's no
Yes.
question.
Yes,
And
for
we're going to
sure.
bring our expertise there.
Yeah. Well, I can tell you, at the time I saw you, my PSA was over 8, And now, thanks to you, it's under 4. So
Yeah,
I'm doing real well.
that's great.
I do have a question here from Michael Bingle, Doc. He says, how
Sure.
often should I have a PSA blood test at 68 years old?
Well, if your life expectancy is greater than 10 years and you may have some family history or of breast cancer or linked with pancreatic or colon or prostate cancer, it's worthy to do yearly PSA. Now, people that are over 74 or 75, we always have a discussion with them and say, hey, do we really need to screen again? A statistic that you should know is that men over 65 with PSAs under 1.5, the risk of dying from prostate cancer is almost 0%.
Yeah.
So there's a role not to check it after so many years. Life expectancy in this country is about 76 right now for men. So, they've already beaten the odds when you're getting an 80-year-old coming through. I don't think there's a need to check PSA at that time.
Okay.
But we always have that discussion with the patient. I think it's important to see what they want to do.
Right. He also has another question too. I don't know. He kind of wants your opinion on colon cancer screening. How do you feel about the Cologuard?
I'm not a colorectal surgeon,
Mhm.
and I'm not a GI doctor, gastroenterologist, so I really can't make that comment. But
Okay.
Cologuard is helpful, but it's just invariably going to lead you to a colonoscopy if it comes back positive. So um, I
Yeah.
think that the screening now is in order. Everyone follows the guidelines anywhere you go. It's going to any gastroenterologist is going to follow those guidelines. So you just got to trust them. Trust your doctor.
Right. Right. Okay. So let's get to know you a little bit.
Sure.
Um,
So,
how long have you been doing this? Blah blah.
well, I've been practicing for 23 years.
Okay.
I was born at St. Mary's Hospital,
Oh, okay.
5 in Levan. That's where my office is. I'm subsequently moving from there and moving into a new practice um, um, in Livonia, a newer building right off 275, one of those gorgeous buildings. We're going to have a little surgery center and
Oh.
participate in there, and we're excited about that. My role at Trinity is kind of limited now, and I'm kind of focusing on Garden City Hospital and the Providence Ascension and Henry Ford with some
Mhm.
teaching capabilities with some the residents. So we're changing gears. Change is good. It's exciting for me. Um, I went to Wayne State School of Medicine and University of Michigan undergrad,
Go
and I
blue.
did my training at Carmano's Cancer Center
Mm.
at uh, at the DMC. I did my training at Harper Hospital for 6 years, and I've been in the same location for the last 23 years.
Wow.
Taking care of the community. I've had a partner for a short while, and then I've just been kind of running kind of like a concierge type of practice where, patients have my phone number and
Mhm.
they're able to call me at any time of the day or night. And it's that art of medicine that's been lost, I think, when you think about it. Those big groups, sometimes you get lost in the shuffle and you don't get the care that you expect from your doctor. But
Mhm.
we have brought that back in the last a quarter of a century, just bringing the right type of medicine, where you're like part family. And that's how I practice. I have a good team and we get it done, and we get it done efficiently. I think a medicine is a good doctor is, a bunch of words that start with A: accessibility, availability, affability, and ability. um, accredited ability. So I think that if we just follow those things and we can really provide the service that everyone wants to have when they think of their medical provider.
Mhm.
And so I'm a little different. I kind of call it a concierge practice, urology practice, but you don't have to pay me yearly that some doctors do. I won't do that to people, but it's really, we're always available for people, same day, and it's been nice that way, and there's no complaints on my part.
Yeah, no complaints from me either because you got me in right away. I couldn't believe
Yeah,
how quick you got me in. So these are some of the conditions you treat now, huh?
sure. So chronic pelvic pain is one of those things that really everyone likes to avoid. Doctors don't know what to do, but we're a center of excellence for interstim therapy. It's sacral neuromodulation. It can actually take these nerves that go to the pelvis and actually control the amount of signal that travels to the bladder, the urgencies, the frequencies, and the pressure feeling. We can really control it beautifully well with a really advanced technique, almost like a bladder pacemaker. People have vaginal prolapse, women that have difficulty urinating and difficult with, relations. And sometimes it's just a pressure feeling that's just so uncomfortable. So that can be fixed very easily vaginally. Um, we started a business 4.5 years ago called Fallofill. The company is, you can go online, it's Fallofill, PHALLOFILL.com,
Yeah.
and it's actually girth enhancement. So as men, we've always been left in the dust when it comes to enhancement. Women with breasts and enlargement and lips and cheeks and lines, but we never had anything for the male counterpart. So we started this company that offers girth enhancement that's non-surgical
Mhm.
and painful, not painful at all, but it's basically hyaluronic acid, which is the filler that's used in the face. That's FDA approved in the face. We do it in the penis, and it's quite remarkable. I would show pictures, but I don't want to go to jail today
Yeah.
for dissemination of
But they can go on your
pictures.
website here. I have it up and they can go
Yeah,
on
no,
there.
there's a link on my website, harburology.com, HARBUROLOGY
Right.
.com, and you can actually go to fallofill.com and it will just lead you to me because I'm one of the only providers in the Midwest, one of them. There's
Yeah.
about 8 of us across the country. I think it's 11 now, but it's remarkable. People travel long distances to come and see me to get this subsequent treatments, and
Mm.
and the sky's the limit when it comes to girth and length. So it's kind of exciting for them. And
Mm.
it's like a tattoo. If you have one tattoo, ask guys if they only get one tattoo. You never stop. Nobody just has one tattoo. But
Right.
it's been fun transforming these guys and making them have some more confidence. It's been good, and
Yeah.
I'm really really happy with that. Um, the urinary incontinence that we take care of is, people think that when you get old, leaking is part of age, but it really isn't. It's totally reversible. The women that leak when they cough is completely correctable with a 20-minute procedure. We can do filler, Bulkamed, we call it. It's like almost like a gasket that we can put there, made of a silicone product, and then we can also do minor slings, small 1 centimeter incisions in the vagina to help lift the urethra to prevent it from leaking. The
Mm.
overactive bladder, there's so many new medications out, and
Yeah.
we can start with that. There's Botox for the bladder we can introduce people to that has to be given every 6 months.
Is that
There's
fairly new? Botox?
Botox has been out. We use it for just about everything on the body, but it sure does work in the bladder pretty good.
I'll be
You
darned.
know, yeah, it's quite effective, and it's very easy to do. Very, very easy. Renal stone disease with all the Polish population and the type of foods they eat, the higher oxalate foods, they tend to have, this is kind of a little stone belt in this little area. There's a lot of stones around here.
Wow.
And chronically dehydrated patients and extra salt, people that eat too much salt in their diet,
Yep.
too many oxalates in their diet. Certain foods with high oxalates can have a higher propensity for stones. So we see so many stones, and we manage them in many different ways: endoscopically, minimally invasive procedures, percutaneously, and with ureteroscopies. So we see so many stones around here.
Wow.
And then finally, people are burdened with, these glands like the prostate can get inflamed, and
Hmm.
it's a painful, painful situation, chronic prostatitis. And we have a nice protocol which includes physical therapy and medical therapy and behavioral modification that can help these guys get through this and resolve it. Um, Urinary tract infections can present them in many different ways, but it sure is a great morbidity for the elderly to have so many infections. These hospitalizations are not easy on the elderly.
No.
And so, if we can avoid people going to the hospital, I think it's the best thing we can offer. And that's what our goals are. So that's what we strive for. And of course, we didn't have on there, the most common thing is, see me to P. That's my license plate. See me to P.
Is it really?
No, it used to be. I used to have one when I first got out. I also had about 2,500 cards made.
Yeah.
Dr. Hard. I was the #1 penile implanter for penile implants for a
Yeah.
prosthetic, and they made the wrong cards for me, but they put D instead of a B for my name. So those are a novelty for me, and I still
Oh
have.
my God, that's hilarious.
Yeah.
I have a question, Doc. Another question for you. It's from Captain Steve Ray's with our Garden City Fire Department. He said, my wife has been struggling with reoccurring UTIs since August. She was hospitalized with sepsis in August and has been on 8 rounds of antibiotics since. Is there a reason why a longer course of antibiotics isn't recommended? She does have some kidney stones, and we have been reading more about biofilms. Any thought on the antibiotic or biofilms?
Yeah, so antibiotics are notorious for forming a biofilm on artificial things in the body. And those things could be an artificial urinary sphincter, could be a penile implant if we put it in, or even stones. So depending on the type of stone that she has, if it's a Proteus or a magnesium ammonium phosphate stone, there's a higher propensity to have a very high pH urine. And the pH of the urine plays a big role because the milieu where bacteria grow becomes a perfect breeding ground where you have a nidus, such as a stone, a biofilm that forms in the right pH and the right environment. And it can be devastating because to eradicate that bacteria is almost impossible until you remove the nidus, which is the stone. So depending on what the pH of her urine is, and depending on the type of stone that she has, it may be worth her while to investigate that because maybe removal of that stone may be the option. As women get older, the pH and the environment in the vagina changes, and so when there's such thing as honeymoon cystitis and cystitis that occurs later in life in the 60s during postmenopausal changes. But when the environment changes in the vagina, the abnormal bacteria take over and the good bacteria are missing. So that's where we start introducing other things to help prevent this, like just plain old yogurt, getting a better, things like uh, those probiotics can help. Cranberry pills are really helpful in prevention of the bacteria adhering to the cell wall in the vagina and things like that. So there's a lot of holistic approaches to take, and we have to look at the whole person before we can make a decision. Now, there is such thing as an antibiotic that can be taken in a prophylactic manner. So we have patients that have a higher residual, these elderly female, that just carry too much urine, they don't empty. So one way to prevent that is to keep a low dose antibiotic every 3rd day that can be safe enough to prevent overgrowth of a bacteria. Remember, when you overnight is when bacteria multiplies tremendously, and then you get the colony counts that are so high that symptoms occur. But there's a lot of people walking around that are asymptomatic because they're colonized with bacteria, but they never allow them to grow. If you pee a lot and you drink a lot of water, you can dilute that amount of bacteria even though it's still there. So theoretically, there's so many things you should look for. You can look for reflux of urine up the collecting system from the bladder. You can look for any abnormalities in the bladder, like diverticulum or urethral diverticulum. So there's a lot of workup that's involved when frequent infections. This can just be postcoital as well. After relations, it can happen. So sometimes a small dose after that can be real helpful. Taking antibiotics for a long time is not really the best thing for the body. It kills off the normal flora in the gut, and then it can be devastating for someone. The resistance
That's what he's worried about.
demise of this culture and this world could be a bacteria that's resistant to everything. And it's a
Mhm.
scary thing. So you never want to overdo antibiotics ever. And you got to take the right antibiotics. So a good, uh, a visit to the urologist can really guide you into the right direction. But
Okay.
all those statements that Steve mentioned are actually true. And he did his diligence and he did his research for sure.
Mhm.
And we'd love to see her too. You call and they'll get you in right away to be seen. We'd love to see you. I'm in the professional building right now of St. Mary Mercy Hospital, but again, I'll be moving in about a month to a new office, brand new place, really nice.
He wants to know, should his next step be an infectious disease doctor, or should he?
I think a urologist would be better suited. Infectious disease, I think, may be better for someone in choosing the right antibiotic for that person and a
Yeah.
safe one.
Okay.
And they measure the concentration in the body and they can make a recommendation and it can complement what a urologist can do. But I think a urologist would be helpful to like look for the reasons that have caused this and how to fix it.
Yeah.
Because maybe her residuals are really high and maybe we should introduce straight catheterization once or twice a day.
Mm.
Maybe her hygiene is poor. Maybe you know there's a lot of things we can look at and try to make this better.
He says she always takes her probiotics, and her urologist isn't really proactive.
Well,
Mm.
everyone's different, and we're not going to judge other people.
Right.
I know the way I practice is I look at the whole person and their environment and everything around, and try
Right.
to look, everything. I mean, we collect data with everything. Like the urine pH is so important to me, and sometimes we can acidify the urine and prevent some of these. And depending
Mhm.
on the type of stone she has, we can address that as well.
Yeah.
So I think there's a role for a urologist to address this. You just have to take time with the patient. You just have to, give them your knowledge. We were given a knowledge base that's pretty immense, and if
Yeah.
we just use a little portion of what we know to take care of someone, I think that's not right. I think we got to put it all together.
Mhm. Well, there you go, Steve. I hope that helped. If you want to, make an appointment with Dr. Harb, he'd love to see you. So
Absolutely, yeah,
Annette McNeil says, "Do you take Trinity Health Insurance?"
of course,
Okay,
yeah,
there you
yeah.
go.
Yeah.
Let's see. Mine wasn't either. I need someone like you that will check everything. Okay,
Yeah,
I guess he's talking about what you were commenting on.
sure.
Steve says, she had cultures done frequently and is the same bacteria, so they are using the recommended antibiotics, but haven't looked into the pH and stone type. Thanks for the info.
Oh, good. Okay.
Okay. All right. That sounds good. And here's the penile implant. Um, that's pretty common too, eh? Getting to be?
Um, the penile, I do quite a few. When I first got out, I was the number two penile implanter out of residency. I trained with one of the biggest guys, Dr. Dabawala at the DMC. And I just had an interest in prosthetic work, and artificial sphincters. And
Mhm.
so I kept training and learning new techniques. And over the years, and what we've come up with is a technique that's an infrapubic approach that takes me about 30 to 40 minutes to put in a penile implant. Most doctors and urologists take about 3 to 4 hours sometimes.
Mm,
And it's always advised to go to someone that does a lot of these because the less time you're in the OR, the less chance of infection and problems occurring. But
mhm,
the satisfaction rates of a penile implant is about 96%. Patients are very happy when they have it and they wish they knew about it. The stigma behind this seems like it's an artificial prosthetic limb, but it really isn't. It's quite natural. Instead of filling with blood, we fill with saline. These are
wow.
cylinders that are inserted, and it's controlled by you with a pump in the scrotum. You can
Mm,
release it and make it go up as long as you want for as many times as you want. And the sensation is there and the same ejaculation and everything. And
mm,
what's great about this is it's covered by insurance. Medicare pays for this.
wow.
Every insurance pay. These are $20,000 devices after this said and done in the OR.
Oh my
You know,
God.
bills are expensive, but it's completely covered. You don't have to deal with injection therapy into the penis or the pills that cause a lot of side effects and they may be risky for the heart. But the penile implant procedure is really, fifth, sixth generation implants, and they're just wonderful. It's just change. It's a game changer in the
Mm,
bedroom for the men.
I
Uh,
bet.
and if they only knew more about it, it would be great. There's a place they can go and learn more about it on my website, of course.
Right.
But fallow boards, it's called fallow boards. It's just it's a kind of like a bunch of blogs about people having it done and what they went through, and it's kind of interesting.
Hmm. Michael Bingle wants to know, can you do girth enhancement at 68?
We can do it in any age. So we gain with each treatment that we do, we gain about a third of an inch uh, and in girth. We also use a sleeve that's made from silicone that we put on. It's worn for 3 weeks. It's taken out for showers and for sex. And what it does is stretch the penis. So we train the penis to be a shower and not always such a grower. Everyone looks good when they're erect, but we strive in making it show the minute they drop their pants that it just welcomes, and it's a big and the way they want it to look.
Yeah.
50% of men have penile dysmorphism. It's a known fact. 50% of men do not like their penis.
Wow.
Isn't that crazy? And now there's a way to make it look the way they want it to look.
Wow.
These sleeves help lengthen the penis in a sense where it just stretches it. So
Uh-huh.
it's a constant stretch, and it really is good. And some men like wearing the sleeve at night because it keeps it on stretch.
Hmm.
Uh, these treatments are given every 3 weeks until they get to the desired size.
Okay.
Hmm.
And they can learn more about that on your website as well. And
Sure.
see
There's
pictures.
a great website. Yeah, the fallowfill.com or my website. There's a link to it.
Dennis Dykman, he's the carpet guy. He says he loves the passion behind your voice. You're very passionate about your work.
Well, thank you. Yeah, I do enjoy it. I work too much. That's my problem, I think. And but I do enjoy life, so there's no question. I have a good family, so and I love taking care of a community. I'd rather be in a smaller hospital like Garden City and St. Mary's than a big Henry Ford or University of Michigan. I think I've had experience in some of the bigger centers. I know it's great for tertiary care and for advanced diseases and things like that, but I'm telling you, it's kind of nice to be in a community where there's community physicians that really care, and that really are attentive.
I had another listener text me saying that you have a great bedside manner as well.
Oh, okay. Thank you. That must have been someone that knows me, huh?
I guess, yeah. When he found out you were going to be on the show, he
Yeah,
just
that's great.
yeah.
Wait,
So,
if you think I'm nice, wait until you meet my physician assistant, Lucas.
really?
They people ask for him. They don't even want to see me anymore. It's
Really?
crazy.
Oh
But
no way.
he knows everything I know. I trained him since he got out. So for the
Oh,
last
there you go.
5 years, he knows everything I know.
Yeah. Captain Ray says, good on the implants, have the girth certificate to prove it. Urologists have the best sense of humor. Doc that did my vasectomy drove a Hummer with a license plate that read PPMD.
Hmm.
Yeah, you got good sense of
That's
humor, that's for sure.
Yeah, no, urology. I went into urology because I love the fact that we can change someone's life instantly. You know,
Yes.
take care of pain, remove a cancer, and improve this and take care of this, and just fantastic results. And we take care of men and women and children, and we can do surgery, or we can just stay in the office and do scopes, endoscopy,
Yeah.
surveillance stuff. But it's just great because I embrace new technology. I always have, and in urology, there's always something new, always something new, new
Yeah.
ways to manage BPH, new ways to manage stones, um, more effective ways to take care of the curvature of a penis. The Peyronie's
Oh,
disease.
yeah, Peroni, yeah. Yeah.
We do injections for that are incredible. They're so successful, and so
Wow.
we do quite a few of that, and that makes a difference for them.
Well, I imagine, yeah, you got to stay on top of all these procedures and all the advancements,
Yeah,
in medicine.
we do, and I enjoy it very much, Carrie. I
Yeah.
really do. I love it. I
Well,
really
we
do.
can tell.
Yeah, no, it's been fun for me more than anything.
Awesome.
It's
Awesome.
gratifying work.
Yes. Well, I want to just show your website one more time. They can go to harburology.com. It's
Yeah.
HERB. And there's all kinds of stuff on here, a lot of good information that some of we couldn't get to tonight. We may have to get you back, Doc.
Anytime, Carrie. I love it. I love coming on, and I love to go out to the community. It reminds me when I first started, I did a lot of this. I did seminars in the hospital in the evening. We'd have over coffee and cake, and we would just talk about things. We talked about incontinence once, about diabetic changes
Yeah.
in the male and the female, and we used to talk about erectile dysfunction and
Mhm.
leaking, and they would come out, and we would drum up. A lot of people would come and see me. It was nice. It was
Yeah,
really
yeah. That's good. Captain Ray says, thanks for the info. Great show tonight, guys. Thanks, Steve. We appreciate that. Also, Michael Bingo says, good. He says he'll be there tomorrow. Okay.
you got it. Sure.
Hey,
Welcome. Yeah,
you're available.
yeah,
So
for
it's 14555 Levan, Suite 309 in Livonia. There's the phone number, 734-462-5858. And there's the website. You can go on there and see all kinds of good information. Michael Bingle says, thank you for the information. Very valuable. Appreciate that, Michael. And let's see what else we got. I think that's about it. You may get some calls, some phone calls. So
Yeah, on the website you can just do it on email too. It comes to me directly. So
right.
and so it's easy to communicate through the website if you'd like to. We
Yeah.
respond the next day or the same day usually.
Captain Ray, he says if you ever want to come by the fire department and talk about urology emergencies, we'd love to have you.
Oh yeah, yeah. We can talk about rings that get stuck and how to take them out safely, and
Yeah.
how to the right way to put catheters in when you
Yeah.
have. Okay.
Yeah.
What else? We can do priapism. I can teach you how to bring penises down when people are using injection therapy and they have an erection for more than 8 hours and it's painful.
Yeah. The blue pill isn't always the answer, is it?
No, no, it isn't, but it sure is available everywhere. That's for sure.
Yeah. It's overprescribed, isn't it?
Well, I'll tell you a story. When Viagra came out, Pfizer brought it. It was stock went out the roof, and
Right.
VA when it came out to put it on formulary on the VA hospital, for the vets,
Yeah.
going to be it was going to run 23% of their pharmacy costs.
Oh, wow.
That's a lot of expense for the government
Yeah. Jesus.
because it was
Mrs.
pretty
Chat,
expensive when it came out.
Mrs. Chat, my wife says, thank you so much for all the great information.
You're very welcome, Cheryl.
Yeah. And she's doing good too. So, well, look, Doc, I just can't thank you enough for coming on. We're going to have you back, okay? Because we probably
Yeah.
just touched on a little bit of all the things you do, right?
Yeah, I can show pictures and I can show diagrams and schematics next time too.
Yeah,
Models.
that sounds good. All right.
We can just do 101 urology. We'll teach about normal physiology and then the abnormal.
We will. We will get you back on. Hey, look, I know your wife is recuperating and
Yeah.
best of luck with her.
Thank you so
Okay.
much. I appreciate it. Thank you, Carrie.
Well, we appreciate you. And like I said, we're going to get you back on, okay?
Sure. Anytime, Carrie.
All right. Have a great night, huh?
You as well. Good night, everybody.
Thank you. All right. There's his information again. Dr. Harb, 14555 Laban, Suite 309. Let me tell you, this guy's awesome. So if you're having any male or female issues, please give him a call. He's a great guy. All right. Now we are going to move on. The next city council meeting is Monday, February 3rd, 7 p.m. in the council chambers located at 6,000 Middlebelt Road. Great way for you to get involved and voice any concerns that you may have. And okay, we're going to get Joe in here now, do tax talk real quick. And then Mike, you're going to be ready to go, right?
Yes, sir.
All right, here we go. Joe with tax talk.
Hi, everyone, and welcome to week 2 of Tax Talk. Hard to believe we're at the end of January now. So this week I thought I would talk about 2 questions that I actually got this week, actually multiple times. The first one is a pretty standard question I get all the time. The second one is a little more controversial question, and people that are easily triggered may not want to listen to the second question that I'm going to answer. But the first one is, and this is common, where people don't totally understand the filing statuses when you file your taxes. Now, to start out with, think of it as 2 filing statuses. You're either single or you're married. Okay. With that in mind, married people have to file married, either married filing joint or married filing separate. Now, it is generally more advantageous to file jointly, unless there's a reason why you don't want to file jointly. Maybe one of the spouses has some back child support or some other obligations that they're going to take any refund, and the other spouse doesn't want anything to do with it. And that's okay. You usually don't do as well when you file separately, but you certainly can. Now, that's kind of the rule. As with taxes, there's always exceptions and there's always fine print. It is possible for a married couple, for one of the spouses to file head of household. Now, the only way this can be is if one of the spouses basically was totally out of the picture, didn't live at the same address, didn't really have anything to do with the other spouse for at least 6 months out of the year. Now, it's a real iffy thing, and you got to be really careful with it, but it is possible. But for the most part, if you're married, you're going to file either jointly or separately. Now, if you're single, you are single. A lot of people question, come in and say, well, I'm head of household. So then my question is, well, who else is living in the household? Well, no one. I'm living by myself. You're not head of household. You're single. If you file head of household, you have to be, sorry for lack of better terms, head of somebody. Like you have a child, or it's even possible, like if you have a very elderly parent that really doesn't make a lot of money. I said parent, it could be any family member really, that you're supporting, maybe does not make money, and you are providing their support and they're living in your home, then you could file head of household. Obviously, a single person with children can file head of household. But if you live by yourself or with Rover, you are single. Now, the second thing that I want to bring up that may be a little so as people ask me, it's been on the news how they have halted the hiring of 80,000 IRS employees, and they've asked how that. People have asked how I believe that will affect things. Now, the thing to remember is, I mean, I've been doing taxes 29 years. I've been in a lot of focus groups. I work with online and in person, many other tax professionals. Pretty much everyone agrees that this is a bad thing for the average person. A lot of it is, as far as customer service, we as tax professionals have been complaining forever that the IRS doesn't have enough employees, and that our clients or the taxpayers out there cannot always get timely information, timely service if there's an issue. So, in my opinion, and I'm basing this on facts, it's not a good thing. You never really want to see layoffs anyway, but especially when the IRS, whether we agree with taxes or not, they provide a service and we all have to pay taxes. And to not have as much customer service is not a good thing. The other thing that someone asked me is, well, isn't that better for us for audits? And here's the thing. Most of us probably that's listening right now, and us average person, anything that we're going to be audited is going to be a mailer, something we're going to be sent. Send us this information, send us that, or ask us a question. Okay, that doesn't take any really manpower. Doesn't take man hour. It's not going to be a difficult. That's not going to change. Okay, the audits that would be affected would be those of the, for lack of better terms, the rich people, the multi-billionaires, the large corporations, because those people have means that they can fight, they can hire attorneys, they can do this, they can do where it's too much man hours for the IRS that has a limited staff to actually pursue. So you draw your own conclusion from there. I'm just giving you facts and what I've known with my experience and what I've talked with other tax professionals on this item. So, think about things like that. Everyone, we all kind of demand good customer service, whether it be at your local McDonald's or the IRS. So, okay. I hope you enjoyed that tax talk. Maybe get some discussion going for you. I'm Joe Bartley from J&J Taxes and More. I've been in business 29 years doing taxes. If you have a question or something, please reach out to Carrie, reach out to me, send me an email. I do, besides taxes, I do accounting, bookkeeping, payroll, property management. All right, thanks, and you guys have a great week.
All right. Thanks, Joe. A lot of good information there. That's for sure. I think I might have missed Jerry Thorne from Party Animal Travels in there. He said the animals are watching the show on the Amtrak train. So, Jerry, if you're still with us, where are you heading? Let us know. Also, Derek Parton from DSD Sports Chat is in there. He says, good evening. Good show. Thank you, sir. They're going to be on in a couple, 3 weeks. So, looking forward to that. All right, Mike, you ready to do some community events?
I am ready, Kerry.
That done, and then we'll close out the show, okay? All right, here we go. Well,
that'll be the day when that'll be the day.
It's time for
Make me cry. Say you're gonna leave.
Mike in here. Mike.
Life does not be the day when I die.
all right, good job. Okay, first one.
Watercolor painting class. Garden City Senior Center. Next one is February 21st and also the 28th, 21st of March and the 28th of March. It's 1 p.m. at Radcliffe Center on the third and fourth Friday of every month. $8 a person, ages 18 and older. Penny Bingo, first and fourth Wednesday of every month at the Radcliffe Center, 1 o'clock to 2 o'clock. 25 cents per bingo card. Bring lots of pennies. Pennies are used as bingo markers, ages 50 and older. Yoga class, Monday from 5 to 6, Thursdays from 5:45 to 6:45, and Saturday from 10 to 11. Drop-in is $6. Punch cards are $36. Punch card visit includes 8 visits.
All right.
Dennis Diekman, a carpet cleaner, does carpet cleaning, tile and grout cleaning, upholstery cleaning, hardwood floor cleaning, residential and commercial. You can contact Dennis at 734-299-6496.
Yep. Dennis is in there watching tonight. And want to mention Dan Bartley is in there from DSD Sports Chat too. Thank you, Dan, for watching.
Straight Farmhouse, 6221 Merriman Road, Garden City. I'm going to get it in, Carrie. Open Wednesdays and Saturdays from noon to 3. They have a plethora of activities and events that you can get information about at their website at www.straightfarmhouse.org.
We love that word, don't we?
We do. One of my favorites. Okay, for your masonry needs, contact Ace Masonry. 30 years experience, brick, block, and stone. Jay Piner is the owner. Contact him at 734-469-0633. When the scaffold comes down, the only thing left to stand on is the craftsmanship.
Yeah, that's a great saying there.
Yeah. Okay, Senior Center presents acrylic painting on the first and second Friday of every month. Tickets are $8. It's for ages 18 and older. It's at 1 o'clock p.m. at the Radcliffe Center. Shannon Coffee of the Notary Babe takes care of all your notary needs. You can contact her at 734-469-8821. Garden City Ice Arena has ice for time for sale. You can have open skating, hockey practices, hockey games, birthday parties. Schedule those at 734-793-1882. Wayne County Veteran Services every Tuesday and Thursday from 8:30 to 4:30. The Radcliffe Center. You can make appointments in Wayne County with 313-506-03. Is that 02? No.
Yep.
And American Legion Department of Veteran Affairs takes care of all your veteran questions and so benefits and questions and so forth. They are available every Tuesday from 9 to 3. Call.
Yeah.
Yeah.
Former Mayor Randy Walker, he is the director of Wayne County Veteran Services, and told me that they have a mobile unit that is getting outfitted right now. So that's going to be another added bonus for the veterans.
Yeah.
It's going to be similar to like the Secretary of State mobile unit.
Angel Aids, amplifying angels' quality of life. Stephanie Peters, 248-818-5344. They can take care of transportation, reasonable rates. They have a variety of services, a plethora of services that they offer for veterans that are either handicapped or have mobility questions and problems and so forth.
Yeah, give her a call.
Parents Night Out, games, crafts, and pizza, $20 per person, ages 5 to 12. They have one on February 21st. Garden City Public Library has a community closet donation list. Individually wrapped toilet paper, dollar store first, and kits, hats, gloves, scarves, socks, non-perishable snacks, soap, shampoo, toothpaste, pads, and tampons, bottled water. All items must be brand new. Please bring donations to the circulation desk. Drop-in hockey at the Garden City Ice Arena. Mondays from 11 to 12:45, Wednesdays from 11 to 12:45, and Fridays from 11 to 12:45. It's always 11 to 12:45.
Yep.
Cost is $12. Sign up and start at 10 p.m. Bunko game night. 10 or 1 o'clock to 3 o'clock at the Radcliffe Center on the second and fourth Mondays of every month. Prizes awarded. It's for ages 50 and up, $5 per person. Bingo at the Rec. Okay, on the first and third Monday of each month from 1 o'clock to 3 o'clock, ages 50 and older, $5 per person. Again, contact them at 734-793-1870. It's Lori's birthday. Haven of Love Dog Rescue Fundraiser Extravaganza on February 1st from 1 o'clock to 8 o'clock. A bake sale, raffle baskets, drink specials, 50/50s at sports venue, 6327 Middle Belt. Euchre tournament starts Saturday, February 1st. Games start at 7 o'clock. 50/50 raffle, prizes for the top three scores, $20 per person to play. Registration starts at 6 o'clock p.m. or pre-register at email. What is that?
Bob Gilbert. Yeah, it's
Yeah.
rjg.euchre@gmail.com.
Okay.
And this is at the American Legion Hall in Flat Rock, 28614. Yeah. Here's
Craft,
your thing.
Craft Day. Join us and paint your own set of wooden earrings. All supplies are included. It's on February 1st from 1 o'clock. No, from 11 o'clock to 12 o'clock, and it's cost $10 per person. All ages are welcome.
Thank you, Annette. Appreciate that.
Yeah, I could use another pair of wooden earrings.
Yeah.
Party Annual Travel, free senior presentation. Love to travel, but want to learn how to do it safely. February 4th starts at 12 p.m. at the Radcliffe Center. Join us for a presentation on being a safe senior traveler. Learn how not to get ripped off by scammers, schemers, and timeshares. Boy.
Yeah. We're due to get Jerry back on the show, too. We're going to have to get a hold of him.
Yeah.
Scheduled.
He's always a good guest.
Yeah.
Okay. Plymouth Canton AAUW presents Beauty and the Beast, February 6th at 7 p.m., February 7th at 7 p.m., February 8th at 11 a.m., and 2 p.m. in the Garden City High School.
Yep. Tickets are $7 online or $10 at the door. And Sue Bellows is actually directing this play. So,
Really?
yeah, we just saw her at the funeral home. We went and paid our respects for Kathy Ward. She passed away. We're going to miss Kathy. She was one of our number one fans.
Yeah.
So our thoughts and prayers.
Kathy was a good person.
She was a great person, really was. So we're going to miss her.
Okay, join us for the Bennett Civic Center Library February used book sale on February 7th to 9th, Friday and Saturday from 9 to 5, Sunday from 1 to 5, pre-sale for members and teachers, February 6th from 4:30 to 6:30 in the Livonia Library.
Yep.
Daddy-daughter dance, Saturday, February 8th. Beauty and the Beast. And I can't read most of that.
5 p.m. to 7, $25 per couple, $10 per each additional child. Dinner to be served, pizza, breadsticks, and salad. Flowers available for purchase. And that's at St. Matthew's Boosters, 5885 North Vinoy Road in Westland.
Okay.
Yep.
Cut, paste, paint, and collage. $50 per child. First and third grades, ages 5 to 9, 4:30 to 5:30, February 10th through March 10th. That's on Mondays. And then 4th and 6th graders ages 9 to 12, 4:30 to 5:30 on February 12th through March 12th, or March, yeah, it's March 12th. February 13th through March 13th.
Yeah.
Which are Thursdays.
Yeah.
Okay, Neighborhood Watch is back. Second Tuesday of every month, 7 p.m. at the Garden City Police Department. Share with your neighbors. Next meeting is February 11th. Senior Lunch Valentine's Day, February 14th from 12 o'clock. Lunch will be served at 12:15. The lunch will be Lee's Chicken. It's $10, ages 50 and older at the Radcliffe Center. You must register in advance.
Yeah, we might register for this and go. I want to try Lee's Chicken.
Yeah. Nerf Wars.
Oh boy.
Saturday, February 15th, 11 to 12, ages 7 to 11, $10 per child. Advanced Kids Cupcake Decorating, February 17th to March 17th. Mondays, 6 p.m. to 7 p.m. Ages 7 to 15 is $50 per person. Kids Cookie Decorating Class, February 18th to March 18th, Tuesdays from 6 to 7, ages 7 to 13, $50 per person. Detroit Institute of Arts. This is a nice one because they're paying all the expenses.
Yeah.
This is a free trip, but you must register in advance. It's on Thursday, February 20th, 12 p.m. to around 3:30 p.m. They provide a bus. So there is no expense to you.
Yeah, no expense.
A mini Palmer's Clinic, February 22nd, pre-K through 8th grade, $45, includes a t-shirt and bombs.
Yeah.
It's Garden City Middle School.
Yeah.
Daddy-daughter dance, March 15th, all ages. $20 for adult, $10 for child. The theme is Rock Out. Registered GardenCityMichigan.org. Parks and Recreation. It's going to be at the Radcliffe Center.
All right. That's all I got.
We had a guest speaker from Inspire Theater today. So
okay.
Let me plug Len's latest play.
Yes.
It's Dirty Rotten Scoundrels, a musical. Friday and Saturday, March 21st, 22nd, 28th, 29th, April 4th and 5th at 7:30. Saturday and Sunday, March 22nd and 3rd, 29th and 30th, April 5th and 6th at 2 p.m. at the Westland Center for the Arts. Get tickets at inspiretheater.ticketly.com. The tickets are $22. Theater's located at 33455 Warren Road in Westland. It's supposed to be a real takeoff on the movie, and a little bit adult humor and innuendo in there.
Oh, okay. Yeah, he does a good job over there.
Yes,
also,
he does.
Don Nicholson delivered the Garden City Marketplace today. Him and his
Yeah, I
wife.
tried to pick one up, but at the farmhouse today, but they still have the January one, so I should get that February one tomorrow.
Yeah, he was delivering them kind of late, so thanks to Don and his wife Gail. They do a great job on that. And with that said, Mike, I think we're ready to call this a podcast. A big thank you to our guest urologist, Dr. John Frederick Harb. He did a great job. I want to give you his address one more time. It is 14555 Levan. That's in Livonia, suite number 308. That's at St. Mary's Hospital. His office is inside. And you can give him a call at 734-462-5858. And he'd love to hear from you. He does a good job. He's my urologist, and I'm very pleased with him. So I do recommend him. Also, a big thanks to Joe Bartley from J&J Taxes and More right here in Garden City. You can contact Joe at 523-8291 to set up an appointment or ask a question. Also, a big thank you to my fantastic co-hosts, Dr. Tom and Mike Jones. Thank you very much. And also a huge shout out and thank you to each and every one of you for sharing part of your time with us tonight and every Thursday. Remember, this show will be available right after we sign off tonight on Facebook, so we hope that you'll catch it at your convenience. If you tuned in late, especially check it out at facebook.com/GCChat. We talked about men's and women's health, so you're going to check it out. And feel free to share the show with your friends as well. Also, catch us on our YouTube channel. Just search for the Garden City Community Chat Show. And while you're there, you'll find not only this show, but all of our past shows as well. Just click on the live tab. And while you're there, hit that subscribe button. We would really appreciate that. And at the end of all our shows, we like to thank all the healthcare workers, first responders, police and fire, everyone on the front lines who serve and protect us every day, especially the ones in Washington. They had a sad, gruesome job to do with the plane crash. We can't thank you guys enough. Be safe, and we want you to know that you and your families are in our thoughts and prayers every day. Whenever you see any of these heroes, please let them know how much you appreciate them. Any final thoughts, Mike?
Just the usual ones. Get vaccinated, protect yourself and those you care about.
Yep. Remember, the success of a community depends on the community, so please support your local businesses. And please, like Mike said, please don't hesitate, vaccinate. Get that booster flu shot. And remember, you're not only protecting yourself, but you're protecting others as well. And Mike, if you see something,
Say something.
say something. Exactly. For all your weather information, head on over to drtomsweather.com. He's got a great user website over there. So we hope you enjoyed the show. Thanks again for listening. If you would like to contact any of us here at the chat for any reason, once again, that email is gccommunitychat@gmail.com. We do like to hear from our listeners. Let us know how we're doing and what you'd like to see more of. We will see you right back here next Thursday, February 6th already, Mike. Can you believe it?
Getting very close to that number 700.
I know, getting real close. Got to come up with something, what we're going to do to celebrate. Remember, you can follow us on Facebook at facebook.com/GCChat and over on our YouTube channel. Just search for the Garden City Community Chat Show and make sure you click that subscribe button. We would appreciate it. Everyone have a fantastic rest of your night and week. Stay safe, stay warm, and good night. Mike, take care, buddy.
Yes, sir.
See you next week.
Yeah.
All right. Thank you, everyone, for watching. I hope you really enjoyed the show. We had a lot of good information from Dr. Harb. If you have any of the issues that we discussed, I highly recommend Dr. Harb for you. So give him a call and don't hesitate. Get it taken care of right away. So you guys take care, and we'll see you next week. Good night.